Whether you're studying to become a certified hand therapist or you're treating a patient with shoulder problems and you're having a really hard time visualizing in what direction it's supposed to move, like the arthrokinematics of a shoulder, so that you can pick the best manual treatments or the best exercises. Well, this video is coming directly from one of my students inside my program, asking about that exact same problem, that they're having a hard time visualizing what direction to push and really understanding the arthrokinematics of a shoulder. I'm going to go into that. So keep watching if that's something that you want to learn about. So don't think about like, oh, how you have to particularly know how to do it, right? Don't think about that. Think about, like, if you're going into forward flexion, right? If you're going into forward flexion, then this is superior, and down here is inferior, right? This is anterior, and the back here is posterior, right? Get someone's shoulder and do it to them so that you can kind of see. So you would never want to physically mobilize anyone superior. But here's what happens when you are going into forward flexion. So you have to roll superior in order to be able to glide inferior. I'm gonna write into my armpit for you. Inferior, right? Inferior is down here in your armpit. In order for you to be able to go into forward flexion, your humeral head has to glide up a little bit before it can glide. It has to roll up a little bit before it can glide downward. So it has to kind of come up a little bit so it can go downward, right? This is why majority of the time people have impingements. It's because their inferior capsule gets so tight that when they roll upward, they're like hitting into their acromion. Let me know if that makes sense, right? So it has to be able to glide all the way down in order for you to clear the space of the acromion. If you cannot clear that space, then usually that's when you get that wear and tear, right? So the ball has to go up a little bit, and then it's gonna roll, glide downward. So it's gonna roll upward so it can glide downward. Rolls superior so it can glide inferiorly. So you can get that full range of motion. So from that perspective, when you are doing a joint mobilization to someone, in order to get better forward flexion, you have to mobilize and glide that humeral head inferiorly. So when the question comes and says, what directions would you glide someone to do a joint mobilization, right? You would say, I want to glide that humeral head inferiorly. So then you are stretching the inferior capsule. Let me know if that makes sense, right? So go back to the shoulder video where I go specifically into the rolling of the humeral head and then the gliding, right? So it has to move downward. So the head has to roll a certain way, and then the whole thing has to glide a certain way. Go back to that video and then try that on people. You don't have to know how to actually do it, but if they are saying to you, if I want to get better forward flexion, in which direction can I glide the humeral head, then you know that you have to glide it inferiorly in order to stretch that capsule out to get better forward flexion without pain, right? So that is just one aspect of it, okay? Let me know if that makes sense. So sometimes if you're not visualizing it, you got to get on someone to do it, right? Use someone's arm to be able to do it. Let me know. I'm gonna move on to the second question that I pulled up. What's the difference between a rotator cuff or a rotator interval and the subacromial space? So it can seem like it's the same exact thing. The rotator cuff, so not really, the rotator cuff interval. So I know the subacromial space, right? So the subacromial space, this is the acromion. This is the core cord process, right? The subacromial space is right here because it's underneath the acromion, right? Now I also know that the rotator cuff, so this is the acromion space, right? The humeral head is here. This is the humeral head, right? And the rotator cuff comes through the subacromial space, and it tends to include this like if you think about, so the subacromial space is underneath here. So here's my acromion, right? Here's my acromion. My subacromial space is directly under there. My rotator interval is more like wherever it's attached. So it's almost like this anterior shoulder. It's to the rotator cuff attaches on the greater tuberosity, but that interval includes like a little bit of that biceps tendon, because that biceps tendon comes right around there. So it's just like slightly off. Let me know if that makes sense. So the location's like kind of similar, but a little different. Let me know if that makes sense.
If you like that type of video and you want to see more of it, then leave me a comment below. Let me know what was your biggest takeaway. Did it help you at all understand kinematics of the shoulder? Do you have those types of questions when you're treating a patient or when you're studying for the CHC exam? If you do, all the links are below if you want to work with me more personally. I've got the exam prep program on demand that can help you get started studying right now. Don't wait until you're like, months away and be like, oh, I wish I had studied. Now the exam's coming again. Just get started today. The link's below. And if you need more help in terms of, just managing your treatments and getting kind of that like personalized feedback and attention, essentially, having someone to go back and forth with in terms of what you can do in the treatment room, the mentorship program, that's the best place for you to get started.